I'm Dr. Nancy Elwartowski, and I'm coming to you for my weekly Live with Dr. Nancy. Our goal with these broadcasts is to kind of help moms, show them some resources around town that, or in the country as we expand, how to raise your kids more naturally or seek other alternatives besides always having to, like I told Amy, reach for the medicine cabinet. So Amy Spillman is one of our patients, and she came into us when she was pregnant, and then we saw her baby afterwards. And Amy, it's okay if we talk about your patient and your baby? Okay,
yeah.
So I'm sure we have your permission.
Yeah.
So she wanted to share with us. We did a call out to see if anybody had an experience here they wanted to share, and Amy was gracious enough to share her story with us today. So I'm going to let Amy share about her experience and what brought her in, and kind of go from there. So Welcome, Amy.
Thank you.
You're welcome.
I had 2 babies in a short amount of time, and within 18 months. So it was kind of a big strain on my body. And with my second pregnancy, I had a lot more early onset, like ligament pain and just some back pain and some stretching things that were not feeling so great. And I was a regular chiropractic care person before. I actually saw a different chiropractor, but he, at the time when I was pregnant, was encouraging me to come see you because he'd heard great things about you with pregnancy and with postpartum, too. And so he referred me, and I came to see you guys, and it was just a complete night and day difference for me. It made a huge impact. And my biggest probably complaint was that I had this really, really sore inner thigh situation going on where my muscles were really challenged there. And so we worked, you did some great adjustments, and then you also offered that the belt that was like a support belt that I could wear, which was really helpful in kind of keeping, my hips aligned and my legs like supported, and giving me a little extra belly support too, so that I wasn't, feeling this. It was almost like a dead leg feeling where I couldn't get my legs to move like they used to. And it was pretty early onset in the pregnancy, and I thought this is going to be a really long road if I don't get this worked out, first. So I was very grateful for that.
Yeah. So it's, the belt she's talking about is called a SI belt, and it's only about this long, or wide, I should say, and it kind of keeps the hips stabilized. Sometimes when we're pregnant, definitely when we're pregnant, our ligaments get looser, and if you have any underlying issues with your pelvis, it can become too movable. So those belts kind of help kind of stabilize, and then you get, helps kind of hold you in, so you feel like what you were feeling in there. Yeah.
It made a huge difference for when I wasn't like seeing you every day. I had the belt when I was at home or at work, and it just made a tremendous impact.
That's great. Yeah. And then you ended up with a healthy baby girl.
I did. Yeah. And so that was the other really, great thing. So I had a C-section with my first one, and I was really unhappy with that birth experience. And so I had a really strong desire to have a unmedicated VBAC the second time. And I was really committed to keeping up with my chiropractic care so that I was positioning myself in the best possible way to do that. And luckily, thankfully, I did. I pulled it off. So it was great. And it was, beautiful baby girl. And she actually started coming to see you too, after I had her. She was a little refluxy. She had a little, digestion stuff going on. But she did so well with all of her adjustments. We always laughed because I don't know if you remember this, when she was so tiny, she, like, when Dr. Nancy would adjust her, these tiny, tiny little movements, she would like lay back and like her little arms would go up, like next to her head. Like she was just totally chilled out and loved it. It took so much comfort, and she slept better those nights, and her like diapers were better situations, and wasn't nearly as fussy. I mean, it was just, we saw great, improvement with that too.
So were you, I know a lot of moms are nervous when they're bringing their children here. Were you nervous at all to bring her here? No.
I mean, it's always a little, the first time you do anything with your kids, you're always apprehensive. But I mean, especially after the first time you saw the adjustments, they're so tiny. It doesn't even look like you're doing anything. I mean, they're laying in like this little comfortable bed thing that is set up in the office. They're not like stretched out on the table. There's no boards involved. There's nothing, and it's just like a little tiny baby adjustments. I mean, they're so small. It doesn't even really look like anything. And she never was upset about it. I mean, that was just my experience, but like
Yeah.
cried, she didn't have like there was no discomfort or anything. She just felt good afterward.
Yeah. And not all babies react that way. Sometimes they'll cry, which is why one of the reasons I like to keep my adjustments a little shorter. Sometimes when people do body work, they do like a longer sessions, but and then they cry the whole time. So I really like to keep them short because I want the baby to be, comfortable when they're here. And it's, there's, I'd say 90% of them are comfortable, but there are some that cry when I work on them just because, and there might be a little more distress, but you were fortunate with her that, that she reacted that way.
I loved it. It was like a baby vacation every
Yeah.
day.
Some of the parents are in the corner going to sleep. It's like a little spa.
Yeah.
Baby spa day. Great. So, are you planning on having more kids?
Oh gosh, that's too soon, Nancy. Too soon. Don't ask me that question right now.
All right, just checking.
No, I mean it's an option for sure. It's certainly something that we've considered, and I would 100% recommend it. I would come back, time and time again. I mean, I have lots of friends that have had kids recently, and I've referred lots of them to you, and they've all been there. And everyone feels the same. Like they've had really great positive outcomes. So that makes you feel good when you're sending somebody that they're feeling like they're getting the same result too.
Right. Yeah, and it's nice too that we don't really do any medicine. We don't poke them or anything too.
Right. There's nothing, to it. And I think that's that tends to be sort of what the options are given to them. Like if you have, pain or whatever, I mean, a lot of times they just are like, well, you can take a Tylenol, that's all they can really recommend at the doc office, or they don't have always a lot of great alternatives. So.
Right. Well, Amy, is there anything else you want to share or any tidbits you want to tell our moms before we sign off today?
Well, no, I would just encourage you to try it. I know there's a lot of schools of that, and especially when you've got a pregnancy, that you want to be very cautious with your baby and with your own health. And then especially when the baby is there, you want to be very cautious. But I'm sure I'm not the minority that would agree that there's just amazing, tremendous benefit from it and positive outcome. And your office, just in general, it's a great environment. Every time lots of families, lots of kids. You're not the unusual person that's bringing your tiny baby in. There's lots of babies and lots of families there. So I think that speaks for itself. Yeah,
so you don't feel alone when you walk in here. There's usually a lot of families.
No, there's lots of families. Yeah.
We have little play dates in the playroom too with the kids, little toddlers. It's so cute.
And extra diapers in the bathroom.
That's true.
Issue. So
yes.
That's good too.
That's right. I thank you so much for coming on today. I know it's hard to get on these Facebook Lives and talk, but I really appreciate you sharing your story with everybody.
Yeah, well, thank you for saving the day. So.
Oh, no problem. And if you know a mom, anybody watching this, if you know a mom that might be considering bringing their child to a chiropractor, not even me, but anybody, just share this with them. It's always nice to hear other moms' experiences. And that's what I encourage moms to do is share your stories with other moms because, there's children suffering out there that, could benefit from chiropractic and they're afraid, so stories like yours really help other moms out. So I really appreciate you coming on.
Absolutely. No problem. My pleasure.
All right. Have a great rest of your day.
Thanks. You too. Bye.
Bye.